Podcast 30, Week 32. Welcome to the podcast, Your Pregnancy Week by Week. This podcast covers the 40 weeks of pregnancy in 38 segments and is based on the book Your Pregnancy Week by Week by Dr. Glade Curtis, MD, and me, Judith Schuler, MS. The information in our books and podcasts is a general informative guide about pregnancy. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctor. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your pregnancy concerns, questions, or interests into words. The goal of every pregnancy is a healthy mom and a healthy baby. To that end, our podcasts cover many topics. In each weekly podcast, we'll highlight information contained in the same weekly discussion in our book. We suggest you read each weekly chapter to learn further information, such as how baby is growing and changing and how you're growing and changing too. Our book also contains illustrations of changes in baby or you, advice for dads, charts, lists, boxes, an exercise for every week, a comprehensive glossary, hints, tips, snippets, and blurbs we just can't reproduce in a podcast. So let's get started on this week's discussion. We're going to look at week 32. Some women enter pregnancy with diabetes, which is a lack of insulin in the bloodstream. It's one of the most common complications of pregnancy. Diabetes can cause problems during pregnancy. Birth defects may be more common and can occur very early in pregnancy. Your risk for having a very large baby increases and may require cesarean delivery. Women with poorly controlled diabetes are 3 to 4 times more likely to have a baby with heart problems or neural tube defects. Insulin is the safest way to control diabetes. If you already take insulin, you may need to adjust your dosage or the timing of your dosage. If you have type 1 diabetes, you may experience a delay in your milk coming in. You'll need to keep your breasts well stimulated to protect your milk supply. There's another type of diabetes I want to talk about. Women develop it only during pregnancy. It's called gestational diabetes. You can get it even if you don't have diabetes before pregnancy. Statistics show nearly 20% of all pregnant women are at risk of developing gestational diabetes. However, research shows only about 25% of these cases are detected. Left untreated, gestational diabetes can lead to complications. Treatment includes a good nutrition plan, increased fluid intake, and 30 minutes of moderate exercise every day. If gestational diabetes occurs with one pregnancy, there's about a 90% chance it will happen again. Your best protection is to stay within the recommended weight gain limits your doctor gives you for this pregnancy and for any future pregnancies. After birth, nearly all women return to normal. However, if you eat unhealthfully after pregnancy or gain weight, you could reactivate the diabetes. Sometimes a woman doesn't have high blood pressure before pregnancy, but develops it during pregnancy. When high blood pressure occurs only during pregnancy, it's called pregnancy-induced hypertension, PIH, or gestational hypertension. The problem usually disappears after baby is born. We've seen articles in magazines and online that incorrectly equate having high blood pressure with having preeclampsia. They are not the same problem. High blood pressure is one sign of preeclampsia, but it must be accompanied by other symptoms for you to be diagnosed with preeclampsia, as we discussed in podcast 29. Your doctor will check your blood pressure at every prenatal visit. That's one of the reasons to keep all your prenatal appointments. Follow your doctor's advice about taking care of high blood pressure, but don't panic. We've talked about not dieting during pregnancy, but the DASH diet may be good for you, especially if you're at risk of developing high blood pressure. DASH stands for Dietary Approaches to Stop Hypertension. It's actually a lifestyle approach to healthy eating and can be safely followed by any pregnant woman. DASH recommends vegetables, fruits, low-fat dairy products, and moderate amounts of whole grains, fish, poultry, and nuts. You can also eat red meat, sweets, and fats in very small amounts. If your doctor recommends the DASH diet, ask to meet with a dietitian to help you make a meal plan. When a woman is expecting twins, her doctor will keep a close watch on her. Most twin pregnancies are healthy. However, there are a few problems that may arise if you're carrying more than one baby. One is twin-to-twin transfusion syndrome, TTTS. Twin-to-twin transfusion syndrome occurs only in identical twins who share the same placenta. Sharing the same placenta allows transfusion of blood from one twin to the other, thus the name. One twin becomes very small and anemic, while the other grows large, overloaded with blood and excessive amounts of urine. The syndrome usually develops between 16 and 26 weeks of pregnancy. If your abdomen gets really big fast, over a 2 to 3 week period, it can be a sign of TTTS. When diagnosed, early treatment may prevent complications. The most common treatment is amnioreduction, in which large volumes of amniotic fluid are drained from the sac of the larger twin. The procedure is repeated as necessary. In another procedure, a hole punched between the two amniotic sacs can help equalize the fluid between the sacs. However, neither procedure stops the twin-to-twin transfusion. Newborns with twin-to-twin transfusion syndrome may be critically ill at birth and have to stay in the hospital. The smaller twin is treated for anemia, and the larger twin is treated for excess red blood cells and jaundice. There's another situation with twins you may have heard about. A woman discovers she's pregnant with twins, then one baby disappears. The term vanishing twin is used when one baby in a twin pregnancy is lost while the other survives. It usually occurs during the first trimester. What causes vanishing twin syndrome? In most cases, we don't know. Examination and analysis of the placenta or fetal tissue may reveal chromosomal abnormalities in the vanishing twin, while the surviving twin is usually healthy. Occasionally during pregnancy, serious problems can occur. Cancer in pregnancy is one rare complication. We're not trying to scare you with this discussion. We're just trying to provide you with information. If you don't want to listen to this section, just skip it. If you're now pregnant and had cancer in the past, tell your doctor as soon as you find out you're pregnant. When cancer occurs during pregnancy, it must be treated on an individual basis. A doctor must consider how to treat the cancer, but he or she is also concerned about the developing baby. Breast cancer is the most common type of cancer diagnosed during pregnancy. Most evidence indicates pregnancy does not increase the rate of growth or spread of this cancer. However, during pregnancy, it may be harder to discover breast cancer because of changes in the breast. Treatment during pregnancy varies. It may require surgery, chemotherapy, or radiation. Studies indicate chemotherapy during pregnancy may be safe. A form of breast cancer you should be aware of is inflammatory breast cancer. Although rare, it can occur during and after pregnancy and may be mistaken for mastitis, inflammation of the breast. Symptoms include swelling or pain in the breast, redness, nipple discharge, or swollen lymph nodes. You may feel a lump, although one is not always present. If you experience any of these symptoms, don't panic. Nearly all of the time it will be a breast infection related to breastfeeding. However, if you're concerned, call your doctor. A biopsy can diagnose the problem. Other cancers may also be found during pregnancy. If you have any questions, be sure to bring them up at a prenatal visit. Remember, our podcasts give you the highlights of what may be happening in any given week. Check our book, Your Pregnancy Week by Week, for more detailed information. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. It covers pregnancy from a man's point of view and provides lots of valuable information a man may find very useful. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It details topics covered in each podcast, so you can listen to a particular podcast or read a certain chapter week if you want more information, or if you want to check out something you missed or a topic we haven't covered yet.